Good evening, dear viewers, and good evening, Abdullah.
Good evening, Dr. Fatma, and good evening, our audience. Welcome to a new episode of your weekly program, Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier lives.
Behind every accurate diagnosis, there is a vital role played by medical laboratories, often unseen but very essential in guiding treatment decisions.
From routine blood tests to advanced diagnostic, laboratory results are a cornerstone of modern healthcare, helping doctors detect, monitor, and manage diseases effectively.
Therefore, to help us better understand this important field, we are pleased to welcome Ms. Kawthar Adel Abdulrasoul, medical lab specialist.
So, dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you are watching Medical Talk.
Welcome, dear viewers, to another interview with Medical Talk. Today we have with us Ms. Kawthar Adel, medical lab specialist. Thank you so much for being with us today, Ms. Kawthar.
Thank you. It's my pleasure to be here. Thank you so much.
Glad to have you here, Ms. Kawthar.
Thank you so much. Thank you.
So, Ms. Kawthar, what is microbiology and why is it important in medical laboratories?
First of all, microbiology is the study of unseen organisms, the very tiny organisms that you cannot see with your own eyes. So you need special equipment in order to see them and to discover them. Like, for example, we have bacteria, we have fungi, we have viruses, and we have parasites. So these kinds of the microorganisms that microbiology studies include. And it's very important to study microbiology because there are some microorganisms that are pathogenic, causes variety of diseases in here. So we have to examine them in order to know how do they work and how their mechanism work, so that we can be able to treat them properly.
So, Ms. Kawthar, can you please explain to us what types of microorganisms are commonly identified in these microbiology labs?
Our job at work, for example, I'm working in the lab.
Yes.
As a medical technician, microbiology technician, I have too many samples. We receive them from the wards and from everywhere in the hospital, especially from the OPDs, from outpatients, from the emergency, from the wards,
yes,
even from the clinics outside the hospital. We receive mostly all kinds of samples from the patients.
yes.
For example, we received wound swabs. We received CSF, which is cerebrospinal fluid. We receive blood cultures. We receive fluids from the patients.
Yes.
We receive urine cultures, urine routines and cultures. We receive stool samples. We receive sputum samples, chest samples, respiratory samples. So we receive many types of samples in the lab. We process them, we culture them, and then we read them. We're not like the other departments of the lab.
Okay.
Like, for example, because we have 6 departments in the lab, they are different than each other, especially in the processing work and the type of specimens they receive and the type of samples they receive. For example, we have 6 departments: histopathology, cytology, we have biochemistry, hematology, and we have virology, and at last we have microbiology. Microbiology works differently than the other parts of the lab.
Yes.
As a senior technician in the lab, we have a mechanism in microbiology. First, we receive the sample. After collecting it, we do not collect any samples.
Okay.
The nurses do that job. We receive the samples, and then we culture them. After culturing them, we process them and we read them. We culture them on specialized media in order to signify the microorganisms that are available in the sample.
Yes.
In order to diagnose what's wrong with this patient, what's wrong with his sample.
Yes.
Is there anything wrong? Does he have any infection? By signifying and IDing those microorganisms with specific techniques, then we ID the microorganisms. We do the sensitivity testings. Like, for example, we do ASTs, special testing. We use special machines in order to know the sensitivity of the antibiotics for this organism. And then we hand out our reports for the doctors in our lab.
Okay.
They will decide whether how they treat the patient, and they will discuss it with the doctors in words.
Yes.
This is mainly our job in microbiology lab.
Fascinating.
Thank
Long
you.
process, but
Yeah,
it's a
very
big,
hard
big,
work,
yes.
and it requires a lot of effort.
Big efforts.
Yeah.
Exactly what I
Yeah,
was
a lot
going
of
to say.
effort.
Yes.
Yeah.
Ms. Kawthar, you were talking about infections earlier.
Yes.
How does microbiology helps diagnose different infections?
For example, I'm going to give you an example to ease up the picture for you. For example, if you received a urine sample from a patient, like, for example, you can say he's suffering from a fever. The doctors are confused. What's wrong with this patient? He has a stomach ache and he has a fever. And when he goes to the toilet, he has burnings while passing the urine. So they take a urine sample. We have two tests for the urine sample. We have either routine, which comes out instantly, and we know certain parameters.
This is the basic one.
This is the basic, the quick one. But the culturing includes, it takes more time. Like, we need an incubation period from 24 to 48 hours in order to take out, to know which infection does it have. For example, after culturing, if the doctor orders a urine routine and culture, we process the routine, we give the parameters, and sometimes, according to this parameters, the doctors ask for a culture, an extra culture, if he didn't ask for a culture from the first time. But if he asks for a culture from the first time, we culture them on a certain media, specialized media, like food for bacteria. They are called food for bacteria in order to grow them.
Yes.
We wait for 24 hours and we start the reading process. The reading process, we can identify.
Bacteria initiate with the
Yes,
food
we have
them.
different kind of medias and specialized in pathogenic bacteria. Not all kind of bacteria, because we have environmental bacteria, different than the medical, the pathogenic ones. We have certain types of media that we can use to grow the pathogenic microorganisms. For example, we have McConkey agar to grow E. coli, gram-negative bacteria, which causes the UTI, which are mainly, she is famous in UTI and in the urinary section infections.
Amazing. So, Ms. Kawthar, can you also explain to us from a lab perspective, what are the differences between viral, fungal, and bacterial infections?
There are
from a lab perspective.
Yeah, of course. You know, the virus is only composed of DNA and a protein coat.
Yes.
This is the smallest that you can see between among the microorganisms. Parasites are really bigger. Fungal are big.
Okay.
Bacteria are small. Bacteria are very small. They are multicellular and unicellular. For example, the bacteria we have different mechanisms to identify bacteria. Like for sensitivity testing, we can read them and we can perform a culturing process for them. But in viruses, we cannot do that. Only PCR and genetic processing, we can identify the viruses. This doesn't work on it. What works on bacteria doesn't work on viruses. So virology section in our lab works differently. They do PCRs. This is the PCRs, which they can detect the genome sequence for this kind of virus, and then they can identify. Yeah. But for bacterial, I can, for example, culture the urine sample on the media, and the next day I can see the growth of the bacteria, and I can, by biochemical tests and by sensitivity tests, I can identify easily.
That's amazing.
Yeah.
Amazing job you guys are doing.
Yes,
Thank you.
Yes, behind the scenes.
Where nobody can see them.
Yes, yes.
Well, dear viewers, we still have more with Ms. Kawthar after this break. Welcome back, dear viewers. We are still with Ms. Kawthar Adel, a medical lab specialist.
Yes.
Ms. Kawthar, let's move on to our next question. How are different samples like blood or urine or swabs are handled and processed in microbiology labs? Can you tell us, please?
Actually, we're a big unit in the lab. In our unit, only micro unit, we have 6 sections, 6 different sections, I think. I'm gonna count them now. We have a blood section, we have sputum section, we have stool section, which is parasitology, we have urine section, we have other swabs and post section. Those sections, we prepare our media inside our lab. This is the technicians' work, actually, not the companies. We do not depend on companies to bring a prepared media. We prepare our own media that we culture the samples on in our lab, in microbiology lab. So we have a lot to handle in our unit. We have all kind of samples that we receive from the patient. We have blood, we have fluids, we have CSFs, we have urine, we have stool, we have swabs, we have sputum and bowel. There are different types of chest samples, respiratory samples, for example, let's say. We handle them differently, actually. Each sample is cultured and handled differently than the other sample.
So the process is different depending on the kind of sample.
You have to know how to handle each sample differently, and you have to differentiate between the samples. Mistakes happen, actually, but we have to first know what kind of samples so that we can process according to the type of sample we receive in the lab. For example, like they took a blood culture from the patient. We have different age for the patient. We have adult patients and we have pediatrics, which is under 14 years. So for blood culture sample, we have 2 bottles for adult and we have 1 bottle for the pediatric. They inject 5 ml of blood in each bottle, and then we culture them. When we receive the bottles of the culture, we put them in the machine. It will stay for 5 days. After the 5 days, it gives an alarm that it's no growth at all. After 5 days of incubation, there is no any source of infection in this blood of the patient, in the blood of the patient. But if it's positive, if there is any infection in the patient, either the aerobic or anaerobic gives an alarm, the device, and it gives you exactly how many, exactly the incubation period. Like, for example, days, hours, and minutes.
Can the machine handle different samples of blood, or is it just 1 sample of blood in the machine?
No, it's just a bottle, 2 bottles, aerobic and anaerobic. It's a media. It's a media. It's a liquid media. It's suitable for the growth of infectious bacteria. And even candida. It's a type of fungi, unicellular fungi. So they inject the blood of the patient inside each bottle, and when we receive them, we incubate them in the machine. And after, like, for mostly gram-positive bacteria brings out 18 hours. After 18 hours, it gives an alarm, there is an infection. So you process the bottle, you process the sample. So we culture it and we read it in another day. And the next day, we read them. There's a lot of different samples that we can handle in the lab. This is a 1 sample. The blood culture is a 1 sample. There is a timing for the collection and the incubation. Or I think most of the nurses should know this protocol of taking the samples, handling, and delivering the samples for the lab. It's already the protocols are already given to each ward and all the departments in the hospital, how to collect samples, how to handle them, and how to, the time period and the safety measures, how to collect them and how to send them.
It's a delicate process.
Yes, yeah, it's a very delicate, especially with, we call them precious samples for the CSF, cerebrospinal fluids, and the fluids from the body of the patient, the blood culture, we handle them. We call them precious samples. Like for bowel, there is a bowel sample, which is a broncholarval wash. This is a sample. There is a device inside the patient where they wash the lungs and they take out the fluid, they put it in a sterile container, and they send it to our lab in order to culture it.
So this is one of the
Yes, this is one of the samples that we received, And
sorry, continue,
and
please.
they are called precious samples because we have to immediately, culture them and we have to, I mean, we cannot let them wait or
Especially
sit
if
for a
the
long time.
extraction was difficult to do, especially when you take
Yeah,
spinal fluids or method.
Of course, yeah, of course.
Abdullah should join Ms. Kawthar in their lab.
I would be honored.
You're welcome
You
anytime.
seem very
would be
interested.
You're welcome anytime
It
if
is
you're
very-
interested. I will show you all the sections in our lab,
Yes.
and I will tell you and I will explain everything for you so that you can see
Yeah, I'm
what
actually
I'm explaining.
fascinated by the different machines and the different.
We have less machines than the other labs.
Mhm.
We have different type of machines for identifying and for the sensitivity of the organisms, but we're not like the other labs. Like, for example, biochemistry, they are mostly dealing with machines. Hematology, but there is a part in the hematology is called blood bank. This is a critical department in hematology, so they handle it manually. But all the section, most of the biochemistry and hematology, they deal with machines, and virology also.
Thank you so much. That was
Welcome.
very informative. Thank you, Ms. Kawthar.
You're welcome.
But you mentioned several times, in fact, more than several times, cultural testing.
Yes.
Can you explain what is exactly cultural testing and how does it help identify these infections?
Yes. Okay. I'm going to talk about one sample
Yes.
as an example,
Yes.
so that it can be easier for you to understand. We have different type of culturing media, which is, I told you earlier, the food of the bacteria.
Yes.
We have different types in order to isolate different kind of pathogenic bacteria from the sample, so that we can have a variety of media in order to isolate as much as we can from pathogenic bacteria from the sample.
Yes.
For example, we have urine culture. We culture them on BA, which is blood agar, and McConkey. It's a very specified media for the gram-negative bacteria.
Okay.
But the blood culture is called a general media that most pathogenic bacteria can grow on it.
Oh.
It's a general media.
Mm.
So most of the samples are cultured on BA first. And then we select different type of bacteria, of media with the BA in order to enhance other types of bacteria growth. Like, for example, if we culture a urine sample on a BA and a McConkey, there is a certain type of culturing streak for the urine, different than the swabs, different than the blood. Each sample is different streaking also. So if we culture, the easiest part in our department is the urine section. It's only 2 medias, and we culture the sample on 2 medias in order to isolate the gram-negative bacteria and the gram-positive bacteria and the fungi, like the yeast. They are the critical pathogenic microorganisms in this section. For like, for example, in post-section, post-sections is like for the type of post-section samples are the swabs, wound swabs. We have the OT samples, the operational theater samples. Like, for example, they bring tissue samples for us in order to culture them and see if there's any infection. After the surgery of the patient, they take samples of the tissue and they send it to us in sterile containers, and we culture them on different type of medias, and we process them. This kind of tissue, this kind of sample takes more time incubation period in order to identify and isolate different type of bacteria.
Well, Ms. Kawthar, thank you so much for this information so far, but we still have more questions for Ms. Kawthar after this break.
Dear viewers, we're back again after our short break with Ms. Kawthar, medical lab specialist. So, Ms. Kawthar, can you explain to us exactly the issue about antibiotic resistance and what role does it play in the microbiology lab?
Yeah. Actually, our work depends on the resistance of antibiotics, because we depend on our test on the sensitivity of antibiotics of these microorganisms, so that we can identify and we can, like, for example, our doctors can, decide which antibiotic is suitable to treat the patients with.
Yes.
According to the sensitivity of this and microorganisms to these certain antibiotics. Recently, we discovered and we noticed that the MDRO, which is multi-drug resistant organisms, are increasing with time. And the MRSA, they are mostly common in hospital because they are hospital-acquired diseases, infections.
Yes.
So they are commonly in, famous and very widespread at hospitals. So the more the resistancy of the microorganism for these antibiotics, the harder to treat.
Yes.
Yeah, because we need to use a higher level of very, broad spectrum antibiotics in order to treat them. And those kind of antibiotics have a very difficult and very severe side effects on the patient. So the more resistancy of these bacteria to these antibiotics, the harder to treat.
Yes.
And it's very difficult to treat, especially for the doctors, in order to decide which combination of antibiotics works for this patient and which doesn't work.
Indeed, indeed.
Yeah.
Thank you.
Ms. Kawthar, what safety precautions are essential when dealing with the different samples, like you mentioned before?
It's a highly required to work with safety measures in the lab. For example, we have to work in full PPE, like we have to wear our masks, goggles, the lab coat should be closed, and we have to wear gloves, and we have special hoods in the lab in order we can deal with the samples inside them. We do not work on bench work. Most of the samples are handled with careful inside the hood in order to avoid the splashing and to avoid the spillage of anything, just in case, to avoid the infection of the technician. If there is any dangerous infections of the sample. In order to avoid them, we have to work under very difficult, very hard safety measures and very strict safety measures inside the lab.
Well, Ms. Kawthar, thank you so much for all the information you provided
You're
today.
most welcome. My
Yes,
pleasure,
thank you
actually.
so much.
It's a pleasure for being here. This is my first time, actually.
It was an honor
Yes,
having
We
you.
were honored to have you.
I'm
yes.
honored too. It's my honor also too.
Well, dear viewers, that brings us to the end of this interview, but we still have more information and topics after this break.